So let's talk about the types of ways people from the community can be involved in research. And again, there's lots of different ways and activities that could be useful. So it might be one-off things like providing some advice on the items that are written into a survey or the questions they're going to be asked in an interview. Or it might be something a little bit more detailed, like being on an advisory committee that meets a number of times over the course of a project. Or it might be sort of at the other end of a continuum where we have completely collaborative projects where the community and the researchers are involved from the very start through to the very end. Now, all of those are really valid and useful ways to be involved in research from the community perspective and from the researcher's perspective. And where we might make those decisions depends on a number of things, like the time and resources that a community person or a community organisation has available to them, the types of skills or resources that people have, and in fact what the researchers might be able to contribute to help support community members or community organisations being involved. And all of those things are open to negotiation and discussion. One thing is important to remember is at the very end of the project, when we start to write papers for academic publication, is to, for the community organisations and for everyone involved to know that we have to work within particular guidelines for those types of very particular outputs. So there are guidelines that we have to meet to say that someone is an author on those particular academic research papers. And we'll put a link to a set of guidelines that shows what a person would need to do to become an author. But really someone needs to be able to stand up in public and vouch for the integrity of the research and to explain the types of decisions that have been made during the research process. That's for that particular type of output or paper. But when we write a report for community to disseminate to community members or health workers or policymakers, that's a very different type of output. And it makes sense then to have a broader authorship group where lots of people can contribute and decide on the content and the style in which research is produced. But I think the main message here is there's a lot of different ways that people can be involved in research, and we really want to draw on people's skills and time to make those decisions of where it makes sense.